First, we'll start by defining infertility. Infertility is defined as failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility can cause emotional stress and other negative psychological reactions like depression, mixed anxiety, depressive disorder, worry, anger, shame, jealousy, or low self-esteem. It can also cause emotional instability, feelings of sexual inadequacy, sexual dysfunction, and it reduces sexual satisfaction. Fertility can change the plans couples had for their life, and because it is something that it is not planned or wanted, it causes many negative feelings that couples don't know how to properly manage. The stress of infertility has negative effects on the quality of life of those suffering from it, and usually women suffer more from emotional distress and other disturbances than men. Women are also blamed more for infertility than men are. Even if the male is the one having infertility issues, women are still the ones being blamed. Research shows that 80% of infertile couples who had experienced a divorce describe infertility stress higher and more severe than going through a divorce. Something else that can contribute to couples feeling very stressed is that infertile couples are exploited and they are pushed to believe that they have to have a baby at any cost. Mental health professionals started to treat couples with infertility back in the 1930s, when almost 30% of all cases were diagnosed as unexplained infertility. Infertile women were believed to have unconscious childhood conflicts with their own parents, and that would result in two kinds of personality styles: emotionally immature or over-ambitious masculine. Fertile men were believed to have high sexual anxiety and experience an unconscious threat from their overprotecting and dominating mothers. But finally, during the 1970s, the link between stress behavior and fertility started being researched. An infertility nurse is believed to be the first person to talk openly about the emotional distress and ethical dilemmas associated with infertility. She published the first infertility self-help book. She formed the first infertility support group, and she also created a newsletter aimed to help people deal with the distress caused by infertility. Also proposed that an infertility team should support the pain that couples were going through. The goal of the team was to decrease the emotional burden of fertility treatments through psychological counseling. Fertility distress began to be understood as a consequence of infertility rather than its cause. Because of this, research on the positive and negative effects of infertility, gender-based outcomes, associated marital and sexual consequences, and treatment stage-wise effects on psychological health began. The period from 1990s to 2017 stresses the importance of evidence-based interventions for handling psychological issues in infertility. Research shows that there are patients that might be more susceptible to needing professional psychological help. For example, patients going through adoption or individuals with elevated stress, anxiety, and depression. Personal factors like individuals with a history of psychological or psychiatric problems, and those for who parenthood is their most important goal. The situational factors would be like having a low social support, and treatment factors that would be like experiencing side effects of treatment, having current pregnancy failures, or too many treatment failures. It's also when patients are planning the end of their treatment, or patients that are having sexual issues. When treatments fail, 2 in 10 women report depressive symptoms. When IVF fails, 1 in 4 women and 1 in 10 men report depressive symptoms. During the same time, 1 in 7 women and 1 in 20 men report anxiety symptoms. Research shows that after 5 years of unsuccessful treatments, childless patients are higher risk of developing substance abuse and dependence of alcohol, tobacco, and benzos than those who become parents through adoption. Research also shows that women that have been diagnosed with infertility are at a higher risk of suffering from sexual dysfunction than fertile women. During a research conducted by, I'm going to say Mosavi, I don't know how you say that name, infertile women reported a lower quality of marital adjustment compared to fertile women. Patients with infertility had lower scores in sexual interest as well as sexual arousal and lower frequency of intercourse. The sexual lives of infertility couples are also affected during infertility treatments. The scheduling sexual intercourse with the goal of procreation is one of the biggest causes of sexual dysfunction among infertile couples. Sexual dysfunction caused by infertility affects the individual's self-esteem, and it also affects their relationship with each other and their relationship with people around them. Research reports that the estimated occurrence of mental health problems can be between 30 to 80% and is linked to the cause, how long the infertility lasts, and the number of pregnancy attempts. Marriages of infertile couples are 3 times more likely to end up in separation and divorce. Research shows that most couples experiencing distress express a need for psychological support, but only 15 out of 62 couples go to therapy and 4 out of 62 couples join support groups. Most distressed patients don't seek psychological treatment because of how expensive it can be, as well as personal factors. For example, they feel like they can manage their worries by themselves. Mutual understanding, communication, effective validation, and coping are the backbone for maintaining each partner's psychological well-being. Research shows that men also go through repeated infertility treatments, and they also suffer from distress from not being able to have children. There is a lack of research on infertile men's psychological needs, since men tend to hide their emotions as well as their grief, and they are not open about their psychological issues. Guidelines on psychological care for infertile men propose that interventions for men should focus on seeing a male psychotherapist to make it easier for the patient to talk about surrounding infertile and sexual issues. The infertility counselor should present psychological intervention as an important part of infertility treatment. Patients should be provided with testimonials of other men that have gone to infertility counseling. Fertility health professionals should have knowledge of the different causes of infertility, psychological stress, as well as sociocultural factors, gender-specific needs, and different treatment modalities. Some of the objectives of short-term infertility therapy are compassionate acceptance of their crisis, acquisition of appropriate ways of communicating their unmet desires and difficulties, refocusing on couple bonding, learning how to deal with their problems constructively, altering maladaptive styles of coping. Awareness of extraordinary situations, for example, adoption, clarifying, redefining infertility, their life, and externalizing their problems. Developing an understanding that even if they try everything they can, pregnancy might not be a possibility, and that's not in their hands or the clinician's hands. Also, setting positive goals for the present and the future that whose fulfillment is not depending on fertility and childbirth. Infertility interventions can be classified in two categories: address psychological problems like grief to enhance pregnancy and conception rates in patients, reduction of psychological distress caused by infertility, and reduction of treatment-related stress. This can be education-based interventions and complex couple-based interventions. Research suggests that structured psychotherapies that last between 6 to 10 weeks are effective at helping with the management of infertility distress. And here are the types of therapies that can be used. I'll let you read them because there's a lot of them. The role of mental health professionals include tailoring evidence-based interventions for the management of emotional distress and treatment stress. This is before, during, and after treatment. Aiding patients make informed decisions according to their needs and preferences. Managing emotions while waiting before pregnancy tests. And helping couples get prepared before they go through different infertility treatments. Also, developing and validating tools that help in clinical decision-making, adaptive coping in patients during critical times, such as repeated treatment failures, ending treatments, and for long-term psychological adjustments to involuntary childlessness. Developing emotional support programs for vulnerable patients. Fertility counseling focuses on the emotional crisis associated with unfulfilled wishes or life goals, the medical treatments required to achieve pregnancy, which tend to involve repeated cycles of interventions which have a narrow success rate. The long-lasting wait creates frustration, disappointments, desperation, and additional marital, familial, and interpersonal stress. The couple dynamics are usually affected as the evaluation and diagnostic procedures affect the intimate lives and personal well-being of couples. Support counseling provides emotional support to patients suffering that can be caused by multiple sources. Its main focus is to help the patients to use their resources to cope with situations both inside and outside the clinic. Therapeutic counseling or psychotherapy in fertility is a type of therapy that is more intensive in nature, and it is offered only by qualified mental health professionals. This type of therapy handles complex psychological processes in couples. Myers and Mork believe that cognitive behavioral therapy is the most suitable way to treat infertile couples, personalizing it according to their needs. Therapeutic interventions in infertile group counseling include cognitive behavioral, emotive interactional, psychoeducational, technology mediated, and staff groups. Investigations have revealed that psychological intervention reduces mental symptoms of infertility. Counseling as well as psychological interventions can reduce anxiety and depression, and it can even increase the chances of pregnancy in some cases. Thank you for watching.